Let's dive into iron deficiency anemia, from the basics to how it actually affects our body. Iron deficiency anemia is the most common type of anemia worldwide. And now about the causes of iron deficiency. We can divide them into four parts. Let's talk first about chronic blood loss. Chronic blood loss is the major cause of iron deficiency anemia. Women with heavy menstrual bleeding run the risk of falling into this category. However, in men, what can cause blood loss is, for example, bleeding from a gastric ulcer or a duodenal ulcer, also cancers, and the long term use of NSAIDs. Inadequate intake in the diet simply means that you're not getting enough iron from the food. This is rare in people who eat mixed diet, but it can happen in people who are strictly vegetarian or are on only vegan diets or generally are malnourished. Impaired intestinal absorption can be seen in patients who have celiac disease, Crohn's disease, and the patients who had already a gastric surgery. And lastly, about increased physiological demand. Where can we see that? For example, during a pregnancy, as the placenta and the fetus are growing, there will be a need for more iron than usual. And if that demand is not met, then iron deficiency anemia will develop. It's not just pregnancy that raises the iron needs. Kids and teenagers who are growing, they will need more iron since their blood volume and muscles are expanding so fast. And now about absorption. Iron is mainly absorbed in the duodenum, and duodenum is the first part of the small intestine following the stomach. That's why some conditions that could damage the duodenum, like celiac disease, often cause iron deficiency. Now, about heme iron, which we get from the red meat, is absorbed most efficiently, and that's why meat eaters do not have iron deficiency. On the other hand, non heme iron, which comes from the beans, lentils, spinach, is absorbed less efficiently. And the absorption is also inhibited by milk, tea, and phytates, which are found in grains and legumes. But the good thing is, vitamin C, which we can find in orange juice, lemon, can actually enhance the absorption of the non heme iron. To understand the bigger picture, let's look at the red blood cell. In a red blood cell, there are millions of hemoglobin molecules, and in each hemoglobin molecule, there are four heme groups. For each one of the heme groups, an iron molecule is needed, otherwise, the heme group will be dysfunctional. These heme groups, they are important for carrying the oxygen, and each heme group can carry one oxygen molecule. Low iron means fewer heme groups can be formed. Without enough heme, hemoglobin synthesis falls, so each red cell ends up with less hemoglobin. And you know that the hemoglobin gives the red blood cells its red color. Now let's imagine if less hemoglobin are inside the red blood cells, what will happen? Well, of course, the red blood cell will lose its color. And that's why in iron deficiency anemia, the cells are pale. And there is a measurement called mean corpuscular hemoglobin, MCH, and it tells how much hemoglobin is contained within um, every red blood cell. And under the microscope, since the red blood cells are pale, you can call them hypochromic, which means they are staining less than usual. And to summarize shortly, hemoglobin contains four heme groups, and for each heme group, you need an iron. And each heme group can carry one oxygen molecule. And in iron deficiency anemia, the normal red blood cell will lose its color, and that's why they're called hypochromic. And at the same time, the size will be smaller. That's why they will be called microcytic. Now, about the symptoms and signs of iron deficiency anemia. Fatigue, weakness, and dizziness. All of them are classic symptoms of reduced oxygen delivery to tissues. Patients become tired easily, feel weak, and may get dizzy, especially on exertion. Tachycardia, palpitations, dyspnea on exertion, and pallor. The body here compensates for low hemoglobin by increasing heart rate and cardiac output. Patients feel their heart racing, get short of breath with activity, and they look pale. Restless leg syndrome is common in iron deficiency and is thought to be linked to low iron in the CNS affecting dopamine pathways. Patients feel an urge to move their legs, especially at night. About angular cheilitis, painful cracks at the corners of the mouth due to impaired epithelial repair from low iron. Atrophic glossitis, the tongue becomes smooth, red, and sore because the papilla, which are the tiny elevations on the tongue, they undergo atrophy because of low iron. And then about koilonychia, the nails become spoon shaped, thin, and brittle, which is a classic and late sign of iron deficiency. And lastly, about pica, it's the craving for non nutritious substances such as ice, clay, and sand. And that's the end of part one of iron deficiency anemia. I hope you found this video helpful. In part two on iron deficiency anemia, we will look at the diagnostic tools and treatment strategies. If you would like to see more, don't forget to like the video and subscribe to the channel. And see you next time.